Hi, I'm Jamie Bussel, Senior Program Officer at the Robert Wood Johnson Foundation. And today I'm thrilled to be joined by Brian Dittmeir with the National WIC Association. Hey, Brian.
Hi, Jamie.
Great to see you. So, Brian, I know that the National WIC Association recently released a new report, State of WIC, and I'm super excited to chat with you about that. Before we dive into the report, Brian, can you spend a little bit of time talking with us about the WIC program and how it benefits babies, kids, moms, families in our country?
Yeah, so WIC is a national program that serves pregnant and postpartum women, infants, and children up to age 5. And the heart and soul of WIC is providing access to healthy foods, but also the public health services that help ensure access to quality nutrition during these periods. And so it's nutrition education, it's breastfeeding support, health screenings for anemia and for other diet-related conditions, and then access and referrals to healthcare and social services as well. And so we really are a hub where new and expectant parents can get not just a monthly benefit for healthy foods, but also a host of community and nutrition supports that help set the stage for future life success.
So many incredibly widespread benefits for those that are participating in the WIC program. Thanks, Brian. So over the last 11 months, we know that the COVID pandemic has really wreaked havoc on kids and families throughout the nation. Can you talk a little bit about how the WIC program has changed or offered additional flexibilities as a consequence of the pandemic and how that's playing out in the lives of participants?
Right. So we know WIC is an effective intervention, right? It addresses infant mortality, breastfeeding rates, quality nutrition. So working on childhood obesity and diabetes prevention, access to healthy foods, and assuring positive pregnancy and birth outcomes. But when it comes to COVID-19, all of the WIC services have historically been provided in a community-based clinic. And just like with medical providers, we've seen a giant lurch forward towards telehealth services as we seek to protect folks from having to come into clinics. And as a result, this shift towards remote services has seen a quite a significant increase in participation in many states, as it's now more accessible and convenient for families to access WIC services. Of course, that comes with some challenges, right? So we're not seeing folks in clinics, so we're not able to do all of the health screenings and the blood tests that we would usually do to assure, to catch some health disparities moving forward. We also know that the shopping experience has come with some new challenges, as WIC consumers are really one of the few populations that still is required to conduct in-person shopping. So compared to SNAP and compared to the general shopping public, these new and modern options like online purchasing and home delivery are not available to WIC consumers in many states. Now, there's a lot of exciting innovations happening on the ground to move us in that direction. It's certainly where the program is going, but in the short term, it's been a significant challenge for our WIC families.
So many flexibilities, it sounds like, Brian, have been deployed, and I think in large part thanks to you and many of your colleagues who've been part of that, and of course, opportunities there, but also risks that you lift up. Can you talk specifically about some of the policy recommendations that you all have put forward in the new report?
Right, so the State of WIC report outlines a comprehensive plan for where WIC can move into the next decade and certainly to reach the next generation of new and expectant parents. And as we look at those steps, a huge piece is learning lessons from COVID-19, is enacting permanent solutions for these temporary flexibilities that have allowed us to harness telehealth and to make progress in modern shopping models. Another big step is to take a look at who we serve and recognize where there are nutrition gaps. So kids age off WIC at their 5th birthday, but they may not yet be in school and therefore eligible for school meals. And so that gap from 5 years old to the beginning of kindergarten is one where we can expand eligibility in a very modest way while making sure that we're reaching those kids and setting them up for success in an educational environment. Postpartum eligibility is another example. By extending our postpartum eligibility, we can continue to have support both in access to nutritious foods, but also the nutrition counseling and chronic disease management that allows us to support the outcomes for mom and help set her up for a healthier subsequent pregnancy as well. And then as we look at the value of the food package, that's another area where we could see some significant benefit. If we increase that value, we're bringing more healthy foods into the household, and we're making sure that kids get closer to what's actually recommended as far as fruits and vegetables and other food groups about what they need to be consuming to have a healthy start.
Some incredibly important policy recommendations and strategies that I think can strengthen an already significantly important program for kids and families in this country. So Brian Dittmeir, thank you so much for joining us, and I very much look forward to the next time we'll chat. Thank you.
Thank you.